Thank you for calling Long Island Council on Alcoholism and Drug Dependence, Open Arms EAP. How may I help you?
In 2015, Long Island Council on Alcoholism and Drug Dependence, LICADD staff, fielded over 10,000 calls from help from people seeking advocacy, counseling, support groups, interventions, and access to treatment.
A couple of years ago, we were seeing 300-400 calls a month, which is still a lot, and now we're up to over 1,000 a month. Just people calling, looking for resources.
Hi, Long Island Council on Alcohol and Drug Dependence and Open Arms EAP. Mary speaking, may I help you? When our phone calls come in, we refer clients for treatment, or if they want inpatient, outpatient, whatever their needs are. And because our population that we serve is so different and diverse, as is our, resources that we provide them with.
The nonprofit agency provides life-saving alcohol and drug prevention intervention services to at-risk children, individuals, and families on Long Island struggling with the effects of addiction. The numbers are staggering.
CDC reports since 1999, prescription drug overdoses, including opiate overdoses, have quadrupled in the last, as it is, 15 years. That's staggering. Over 30,000 Americans lost their lives to overdose last year alone. We're losing more than 350 a year right here in Nassau and Suffolk. And unfortunately, on Long Island in New York State, we have the sad statistic of the most number of fatal overdoses was in Suffolk County. So when you talk about standing in the epicenter of the crisis in New York State, Suffolk County is it.
As the 24-hour hotline provides screenings and referrals for those seeking assistance, Long Island is faced with an opioid epidemic of historic proportions. Opioids are most often used by prescription to relieve pain. In 2015, an estimated 43% of individuals who overdosed on heroin are addicted to opioids.
There is this mentality across the nation, and you'll find no shortage of prescribers willing to prescribe a whole host of medications to enhance the human experience for one reason or another. But that whole better living through chemistry mentality has really contributed to what is the greatest public health crisis we've seen around substance use and prescription medication in this country, which unfortunately has taken the toll of the human toll of so many Long Islanders, New Yorkers, and Americans at a rate we've never before seen.
Recent arrests may suggest that law enforcement on Long Island are taking steps in the fight against drugs.
And this gets twisted on the top like this.
LICADD is also training law enforcement and ordinary citizens on how to use a Narcan device that helps reverse the effects of an overdose and save a person's life.
We work very closely with both county executives, Executive Mangano and Executive Bellone. We work with both county police forces in conjunction. Now, as a not-for-profit community-based organization, we are not here to help the police do their job, other than we support the police in doing what they can. We need to work with people who struggle with substance use disorders, people that are afforded treatment. We need to support them in their road to recovery, and if there are setbacks or relapses, re-engage them and help them along.
I would certainly like it if you came now. As soon as you can, I'll be waiting on you, okay? And we'll have a talk.
If you or someone you know suffers from substance abuse, call the Long Island Council on Alcoholism and Drug Dependence 24-hour hotline at 631-979-1700 or go to licadd.org. For Push Pause in Mineola, this is Archie Snowden.